Madam President, it's that time of the week that, our pages, when we had them, used to always look forward to. It's the time of week that I come down on the floor and talk about someone in Alaska who's making a huge impact on my state. A lot of times for the country, these two Alaskans I'm going to talk about actually have gotten national news for the great work that they're doing. Somebody we call our Alaskans of the Week, and it's usually about a group of individuals, one, two, maybe a group of people who are helping make Alaska what in my view is the greatest state in the country. Resilient, tough, generous, kind, unique. And Madam President, like so many states, this pandemic has really hit Alaska hard. Tourism, for sure. The oil and gas sector, last year really hit hard with low prices. Unfortunately, this year with the Biden administration's attacks on this sector of the U.S. and Alaska economy, it's tough. Commercial fishing, tough. It's been a tough year economically, but in an area of good news during the pandemic, one that I'm very proud of for all my constituents, involving how we in Alaska have responded on the health side. Vaccines, testing, death rates. We have consistently been the top state rated in all of these categories throughout the pandemic, which is kind of amazing given that we are a very, very big state with a very small population. I know that so many Americans watching right now, they want to get back out, visit Alaska. Our governor, Mike Dunleavy, recently tweeted, with the best vaccination efforts in the country and some of the lowest COVID numbers in the country, Alaska is open for business, safe for travelers. So come on, America, get back up to Alaska. Love to have you. So this is all very true. Our vaccination efforts are viewed as the best in the United States of America. And the great lengths that so many in Alaska have gone through to make it so have captured the country's imagination. These efforts, just in the last couple weeks, have been featured all across the country. USA Today, Good Morning America, The Washington Post, The New York Times, a great piece by Bloomberg News, and so many others. So big thanks to the Press Corps, National Press Corps, for featuring my state's efforts and, importantly, the heroic work being done to distribute life-saving vaccines to a state that is more than 2.5 times the size of Texas. Sorry there, Senator Cornyn, Senator Cruz, it's true. And most of the geography of Alaska is dotted with small villages without roads in freezing cold temperatures. I was in Fairbanks last weekend, just a couple weeks ago in Fairbanks, almost hit 40 below. That is cold. All across Alaska, our healthcare workers are jumping on boats, single prop airplanes, snow machines, and yes, in a couple cases, dog sleds to bring the vaccine and hope to their fellow Alaskans. And it shows. As of a few days ago, close to 160,000 Alaskans received at least their first vaccine dose. That is about 21% of our state's population. Now, Madam President, in Southwest Alaska, what we call the Yukon-Kuskokwim Delta, or the YK Delta, those are two giant rivers that come together, these efforts have been particularly impressive. That's largely thanks to the amazing people at the YK Health Corporation, or YKHC, which is the YK Delta's tribal health provider. The whole organization, consisting just about 90 healthcare professionals, serves around 28,000 people in the YK region, which is about the size of Oregon. So, huge area. Not a lot of people. And prior to the vaccine, the YK Delta had been stricken by COVID-19 with one of the highest infection rates in the country. in a very far-flung place in terms of the disbursement of the population. But it's the efforts of two women there in the YK Delta, Doctors Ellen Hodges and Elizabeth Bates, who are our Alaskans of the week, who have been in charge getting the vaccine to roughly 50 remote villages in southwestern Alaska, spread out over a territory, as I said, about the size of Oregon. The village populations in the YK Delta range from about 1,200 people to as small as 10 in terms of population. So let's start with Dr. Hodges. She is the chief of staff at YKHC. She grew up in rural Minnesota. After graduating from the University of Minnesota Medical School, Dr. Hodges came to Anchorage as a resident in 2002, eventually making her way to Bethel, which is the hub village. It's a big community, the biggest in the YK Delta. She absolutely fell in love with the area. She said, "It has everything, very friendly people, authentic, it's beautiful." Soon enough, her patients turned into her family. Also soon enough, she was, according to Tricia Franklin, Alaska's director of the State Office of Rural Health Division, she was, Dr. Hodges, the go-to person for how things are working in rural communities and how to get things done. She worked in the emergency room, tending cuts, bruises, broken bones. She delivered babies. She worked tirelessly to contain a number of serious tuberculosis outbreaks in the region. And then, Madam President, the virus hit. And as I mentioned, it hit the YK Delta region very hard with some of the highest COVID rates in America. And there are reasons for that. The multi-generational housing, very crowded housing in this region, communal lifestyle, and also, here's a big one, Madam President, and it should be a shock for every American listening. About 50% of the households in this region of America lack running water. Let me say that again. Some of the most patriotic communities in the country, because Alaska Natives serve at higher rates in the military than any other ethnic group in the country, live in communities that don't have running water or flush toilets. American citizens. It's wrong. It's wrong. And we, the U.S. Senate, Congress, need to continue to work on this issue. How do you wash your hands 5 times a day, but as the CDC wants you to do during the pandemic when you don't have running water or flush toilets? We need to keep working on this. It's a disgrace, to be honest. So what happened when COVID hit in this region, because of a lack of sanitation and many other problems, precious lives were being lost. Elders who are vital to pass on the traditional wisdom of the native Alaskan culture and heritage were being lost. And because of a lack of functioning sanitation, even young people, which this virus doesn't really impact, were starting to have respiratory illnesses and getting sick, and some were even dying. That's horrible. It was terrifying, particularly for an area that is still dealing with the multi-generational trauma of previous pandemics, particularly the Spanish flu of 1918, which in several Alaska Native communities wiped out entire communities. 60, 70% mortality rates from that flu. So, we needed to get to work fast, particularly in this region. Enter another intrepid doctor and our other Alaskan of the week, Dr. Elizabeth Bates. Dr. Bates arrived in Bethel in December 2018, just a little over 2 years ago, and she found a community that she loved. She had experience working in women's health, in infection control, in emergency care, and disaster relief. She had great experience across the country, really across the world. As a doctor, she worked with patients during 9/11, Hurricane Katrina, and had spent time even in refugee camps in Rwanda. In Bethel, she was in charge of setting up testing centers for the region. Working hand in glove with Dr. Hodges, she started one of the first drive-through and airport testing sites in rural Alaska, much of it outside in the cold weather under tarps. But we all know, Madam President, that testing alone, particularly, as I said, when people are living so close together and don't live in places where you can wash your hands frequently, testing alone wasn't nearly enough. They tried everything: public service announcements, reaching out to villagers, helping them use bleach to sanitize. It was a 24/7 effort, but as I said, it wasn't enough. The virus was spreading rapidly. They were losing. People were dying. And then, on December 18th, a few days before winter solstice, the darkest day of the year, hope came to Bethel, Alaska, because the first vaccines arrived. Thanks to the great work of so many scientists, government workers, private sector workers, Operation Warp Speed, the vaccine arrived. December 18th, the YK Delta. These two intrepid doctors I've been talking about cried. They had seen a lot of death and struggles in the region, and like a Christmas miracle, this vaccine arrived. They hugged each other, and then they got to work. As I said, there are roughly 50 remote villages in the YK Delta spread out over a territory about the size of many states in our country. As a matter of fact, bigger than most states in our country. So they traveled on small planes, trucks on ice roads, snow machines, dog sleds. Their operation, Project Togo, named in reference to one of the famous sled dogs that helped carry the diphtheria serum to Nome, which of course is the original inspiration for the Iditarod sled dog race. Sometimes it was so cold that they had to keep the fringes filled with COVID serum under their clothes, lest the serum froze. The operation that they initiated and organized has hit every single village, all 50 in the YK Delta, bringing the vaccine to pretty much anyone who wants it. In some villages, they've been able to vaccinate as much as half the population. As a result, the numbers of COVID infections and deaths are plummeting in this region, and hope is spreading. This great team, Dr. Hodges and Bates, as well as all in the community and all working at YKHC, have made a huge difference. And this team has created a special bond that nobody will forget. Dr. Bates, a relative newcomer in Alaska, says that the experience has made her fall in love with the YK Delta region even more. She bought a home. She intends on staying. She describes the beauty of the region. Something that she appreciates even more now is, quote, "Our sky is huge. We have a front row seat to the entire universe." These two doctors also have a front row seat in providing a front row seat to hope during this pandemic. So I want to thank both of them again, Dr. Hodges and Dr. Bates, and to all those across Alaska who are helping distribute the vaccine. As I mentioned, right now, Alaska is the #1 state in the country per capita in terms of vaccine distribution, and the #1 state per capita in terms of testing, and one of the lowest death rates. This is really amazing, really, when you see how big and widespread and harsh the weather conditions can be in the great state of Alaska. Our fellow Alaskans are tough, resilient, innovative, and Dr. Hodges and Dr. Bates are a huge and essential part of this effort, and that's why I want to congratulate them and thank them again for being our Alaskans of the week. I yield the floor.